Government pandemic advisor Professor David Hui said the COVID pandemic has ended. He revealed that health authorities will discuss later this month whether COVID vaccines should be regularly administered to the public. Jackie Lin with more.
On this very day, 3 years ago, the World Health Organization declared the COVID outbreak a global pandemic. Today, a familiar face in the city's battle against the novel coronavirus said Hong Kong's COVID pandemic is over. Speaking on the radio program, Government Health Advisor Professor David Hui said this watershed moment has been corroborated by ongoing data in recent days. He noted local infections these days mainly involve the Omicron BA.5 and BA.2 variants, which are higher in transmissibility but lower in mortality rates. The number of severe cases and COVID-related deaths has remained in the single digits as well. Plus, the low viral loads in sewage samples, Dr. Hui said the data reflected the COVID situation in the SAR is stable with a very strong immunity barrier. He said with the pandemic deemed over, the Center for Health Protection will discuss with a scientific committee at the end of this month on whether COVID jabs should be administered to the public on a regular basis. And they will take a cue from the outcome of the World Health Organization's meeting on COVID vaccination arrangements, also happening later this month.
I guess the elderly, those who have chronic illness, those who are immunocompromised, they will definitely need to have regular jabs. But the frequency, we need to wait for the recommendation by the WHO, probably maybe every 12 months or so.
Professor Hui also reflected on the city's fifth wave of the outbreak.
Vaccine hesitancy was a big problem. Many elderly were unvaccinated or not fully vaccinated. So they develop very severe disease and require hospitalization. At that time, we were also implementing the containment policy. That actually flooded the hospital, overload the hospital system.
He said home isolation for mild cases should have been introduced earlier to ease pressures on the public health sector. Jackie Lin, TVB News.